I'm going to start with the most important information, and this is especially important for the people of Alice Springs. There have been no new positive cases in the Territory in the past 24 hours. However, based on information we received this morning, which I will go through in a moment, we now need to enact extreme precautionary measures for Alice Springs. Effective from 1 p.m. today, Alice Springs will enter a full lockdown for 72 hours. I will now explain why we had to make this decision. I will then explain what this means for the people of Alice Springs. This relates to a man from the Tanami mine site who spent an extended period of time at Alice Springs Airport on Friday, the 25th of June. He arrived at the airport via a charter flight on Friday morning and remained at the airport between 9 a.m. and 3:50 p.m. He did not exit the airport. On Saturday, the 26th of June, after returning to Adelaide, he got a COVID test. That result was not positive. However, he has since developed symptoms while isolating in Adelaide, and 4 of his 5 household contacts have now tested positive. For this reason, we believe he is positive for COVID-19, and we believe that he is highly infectious. It is unlikely that he was highly infectious during his time at Alice Springs Airport. But, like all our other decisions, we will not take a punt on this. We will operate on the assumption that he has COVID-19, and we will operate on the assumption that he was infectious while in the Territory. So the Alice Springs area will now enter a lockdown for the next 72 hours to Saturday. The lockdown direction applies to everyone inside the Alice Springs Town Council boundaries. That includes town camps. We know that there are specific communities around Alice that rely on the town for groceries and medicine. We are now going to go through the process of declaring those areas as lockdown areas as well. This is so that you are able to travel in and out of Alice for essentials. Do not panic. You will get your food. You will get your medicine. We will speak with those communities now. We will update you all on that later. But if you usually live outside of Alice Springs, like in a community, but you are visiting in Alice right now, stay in Alice. Stay there. Do not go home right now. If it is critical, we will be able to help you go back to your home community, but stay where you are now so we can help you and work through that with you very carefully in a way that is safe for everyone. For everyone in lockdown areas, you must stay at home, and you are only permitted to leave your home for the following 5 reasons. 1, medical treatment, including COVID testing or vaccination. 2, for essential goods and services like groceries. 3, for work that is considered essential. 4, for 1 hour of exercise a day with one other person or the people that you live with, no further than 5 kilometres from your home, and to provide care and support to a family member or person who cannot support themselves. The direction on mask wearing also now applies to people in these areas. If you leave your place for one of the 5 reasons, you must wear a mask. Just like the top-end lockdown, there will be interdiction points to establish travel in and out of these areas. The Police Commissioner will go through that. But you should not travel unless it is for one of the 5 reasons. Now, to important information on potential exposure. This is very important for everyone in Alice Springs. Please listen carefully. The Alice Springs Airport is an exposure site, but there are different levels of exposure. As I said, this man spent 7 hours in the airport, mostly at the cafe, and several trips to different bathrooms. If you are at Alice Springs Airport between 9 a.m. and 4 p.m. on Friday the 25th of June, please listen carefully. Stay where you are. We are now going through a process of refining which areas of the airport are close contact, which areas are casual contact, and which areas are low risk. This will determine your risk of exposure. It will determine whether you are under a 14-day stay-at-home order, whether you need to isolate and get tested, or whether you just have to monitor for symptoms. Do not go and get tested yet. Wait for us to tell you today which category you are in. This allows us to prioritise the high-risk testing first. right now. We believe that people who spent time in the departure side of the airport on Friday between 9 and 4, the cafe side, are considered as close contacts. Being a close contact would mean you're under a stay-at-home order for 14 days, as are your household contacts. On the other side of the airport, where you enter the building, that is currently considered a casual contact site. That would mean anyone on that side of the building needs to isolate and get tested and stay isolated until you get a negative result. And we consider the car park and drop-off area of the airport as a low-risk site, meaning you only need to isolate and test if you develop symptoms. However, and this is important, we are reviewing the CCTV footage of the airport right now to determine the man's movements. Then later today, we will provide more information on the exposure site. Right now, I will repeat, for everybody who was at the Alice Springs Airport on Friday, the 25th of June, you don't need to do anything right now except stay at home. Stay at home, in lockdown, and later today, we will provide advice on what you have to do in terms of isolating and testing. Do not rush out now to a testing facility. We do not want people leaving home and flooding the testing sites. We need to prioritise that for any high-risk individuals. There won't be many, but we want them in front of the queue for testing. So later today, we will provide more information on the exposure sites at the Alice Springs Airport, and then you will know what you need to do. For everybody else in Alice Springs, there is no automatic requirement to get tested. You don't need to get a COVID test unless you're at the airport on Friday or unless you have symptoms. Please heed this advice. Our testing capacity needs to be directed to those who have been at risk of exposure. Just like the top-end lockdown, we made this decision very quickly. I know it is sudden and shocking. I am sorry about that. But we cannot afford to wait a minute longer. Our incident management team is established in Alice Springs to help coordinate this lockdown. There are authorities on the ground now. They can help you. We have briefed the Minister for Central Australia, the Alice Springs Mayor and local members. Our hotline is still open if you have questions. 1800 193 111. 1800 193 111. Please be patient while our team gets through all the calls. But remember the general rule of thumb. If in doubt, stay at home. Remember, supermarkets stay open. Our essential stores stay open. Cafes and restaurants are open for takeaway. We have no food supply issues in the Territory. For communities outside Alice who rely on Alice for their supply, you will not be impacted. We will work that through with you. The Police Commissioner will explain in a moment how we will manage the interdiction points to ensure people outside the lockdown area can continue to get their supplies. I will give you an update on the top-end exposure sites. The Zebra class in Palmerston on Saturday morning. All 26 attendees have been contacted. They and their household contacts are now under a stay-at-home order for the next 14 days, and testing is being arranged. 6 of the people have already turned negative results, and we will continue to provide updates on the outstanding tests. Now to the Buff Club on the Stewart Highway. The number of close contacts is now 179 due to our close contact tracing. As part of that tracing, there are currently 8 who we are still working to contact to ensure they are complying. This remains a priority. Police are on it. We are under a lockdown order, and these people should be isolating anyway. All tests are currently negative from the Buff Club. I said yesterday we're still waiting on one result from the 7 high-risk contacts, the people who had spent a lot of time at the Buff Club, or with that positive case. We've now got that result back. It is negative. So we had 7 people we were very worried about, and all 7 are negative. They will stay at the Centre for National Resilience in Alice Springs for their 14 days of isolation. But as is now very clear to us, just because they are negative now does not mean they won't be positive later on. That's why all close contacts that stay isolated for the full 14 days. To the casual contact exposure sites. As I flagged yesterday, the information for the sites at Gateway Shopping Centre were updated with the specific exposure periods. Those time periods are very narrow. We're talking a window of 10 or 20 minutes. So if you spent time at any of those exposure sites, please visit the coronavirus website to see if the time period applies to you. For example, the Big W in the shopping centre, the exposure period is now only 10 minutes on Saturday, 12 to 12:10. If you're in Big W, outside that period, you are not automatically required to get a test. On yesterday's testing blitz, more than 2,600 Territorians came forward for testing yesterday, and I thank you all. Testing remains an important weapon in helping us ensure there isn't any hidden community transmission. We've already got more than 2,400 tests back and all are negative, which is a great sign. At the Marara drive-through clinic alone, there were more than 2,000 tests done. I know that some people had to wait a long time for tests at that site, and I thank you for your patience. Please continue to come forward for testing if you have symptoms, but please book in at www.covid19appointment.nt.gov.au. We are continuing to open up more appointments at Marara and putting more resources out there. We will stay open longer if required. To everyone in Alice Springs, I know this is really challenging. The reason we are doing this lockdown is the size of the exposure window and the vulnerability of the local population. I will take no risk with that, no risk. To all Territorians, I woke up this morning hoping this was a day for good news, and there is some good news. There is 0 cases today. But we are still in a dangerous period. The Territory is still under threat. So long as that threat is there, we will do whatever it takes to keep the Territory and you safe. Thank you.
Thank you, Chief. Again, this is really important and critical. So I'd like, first of all, to the people of Alice Springs particularly, please listen very carefully. Earlier this morning, literally only a few hours ago, I was contacted by my colleague in South Australia about a Tanami wine worker that had travelled through Alice Springs Terminal, as the Chief has described, and had spent some time there, travelled on, had an initial swab, and that one was not positive. And there's a range of reasons why that might be the case. But very importantly, 4 out of 5 of his close contacts, as in family members, have tested positive. So this does pose risk to the community of Alice Springs. I will say that because this has not been the experience, it's going to be some challenges, but please take this seriously. The best thing you can do is stay where you are. Stay at home, or if you're from out of Alice Springs, find someone else that you can stay with. As the Chief Minister has said, we are going through a process to identify the people who were most exposed in the terminal, and there's work to be done, and the Commissioner is assisting with his team. It's important that the community understands that at the moment the priority testing is going to be people who were most exposed. There would be people who work in the terminal or potentially visited the terminal during the time that the case was present there. I want to mention at this point, because we have this evidence now, the genomic testing of these cases have been validated to be the Delta strain. Highly infectious, infectious early on, sometimes maybe with a shorter illness, but very infectious. Hence the mask wearing. And there's going to be masks available in a number of outlets in Alice Springs. That's important. And if I could say this, we've got multicultural groups in Alice Springs. All of this needs to be communicated to people who may not have English as their first language, or a limited understanding of English, or do not access a number of media outlets and channels. Specifically, I wish to reach out to the Aboriginal people in Alice Springs. And I'll say this carefully. Ayenga Kapatakamara, Nankara, Alagan, and Bladovich, Yorpanja, and Mungana, Alagan. Please stay where you are. There will be food, there will be assistance. We're working closely with Congress and the Tanangera Council to make sure you're safe, you have mask supplies, you have food. For those people who live at outstations and other communities, there's going to be a process as described to make it sure that you can access the, importantly, the important reasons for leaving your place of accommodation or home. To the visitors in Alice Springs, I know you've come here perhaps to experience the wide open spaces and maybe the weather, but also maybe the controls and lockdowns in other places. Well, here we have now 12 million people who are actually in lockdown around the country. That's nearly 50% of our population. So we're all dealing with this around the country, and I want to make it also abundantly clear, the best thing you can do is not move around. There's some news about the wastewater testing in Darwin, that the test that was done on Monday, it was negative around the different sites. Obviously, Howard Springs is always going to be positive. That's good news. But saying that, it's the coming days of daily wastewater testing that are critical to indicate whether we've got any cases that we don't know about, and that information will be provided. In Alice Springs, the equipment was delayed and it arrived in Alice Springs yesterday. They'll be doing wastewater testing today, and also that it does take 24 to 48 hours to get the report back because it has to be sent interstate. Again, this is so important for the Territory, our lifestyle, Territorians and those who've come to be here, that we actually do comply. And I'm going to say again to those people who actually don't wear masks properly or don't wear them at all, you are running the risk of spreading the virus if you might have it. And I know some of you will say, well, you know, I run fast, it's hard to wear a mask. Well, maybe you don't run as fast. The risk for me is actually sometimes when you stop and talk to people along the way. So thank you for everybody, and I want to particularly thank a lot of teams that work well into the night after a long day yesterday or across a range of things, again starting very early this morning. Our partnership with others and with the community is so important. Thank you.
Thank you, Dr. Heggie. The Southern Incident Management Team has been activated in advance of the lockdown for Alice Springs at 1 p.m. today. The community of Alice Springs can be very reassured we will get public messaging out to you, as has been indicated, as we do our forensic analysis in partnership with our health colleagues on the movements of the individual at the airport last Friday. We will be able to consolidate the information to ensure we can prioritise the testing arrangements that will be in place. The key message: there is no need to panic. Do not rush to the supermarket right now. The supermarket will be open past 1 p.m. You will be able to get access to stores. Again, our clear message is one individual from the household, please go. If you have adequate store for today, don't leave home. Stay home. Go tomorrow. If you assist us, then I can ensure that our resources are pointed where they're needed the most, to be able to work with our most vulnerable down there. It is the case in Alice Springs that we do have a high cohort that would be identified as vulnerable. We will be working with the Central Land Council, with Tangentyere Council, a multitude of other not-for-profits and non-government organisations to enable sufficient information, resources and other support that you may need. The clear direction: stay home. Stay with family, stay with friends, but stay together. Do not move out and about. If you meet any of the reasons to leave your home, you must wear a mask. That is mandatory. There are fines associated with not doing so. We will again move into an education posture for Alice Springs as it relates to the enforcement. We know people want to do the right thing. Unfortunately, this morning we issued our first infringement for an individual 36-year-old male in Darwin in the CBD who frequented a coffee shop, who simply refused to wear the mask and after multiple engagements with our people continued to be recalcitrant. He's now $5,056 poorer. Ignorance is not going to be tolerated. Let me be very clear about that. The information, the education, we've been very clear. The activities that will occur in Alice Springs as you see authorities move around is that we will have road interdiction points on the North Stewart Highway, the South Stewart Highway, Undulia Road access and also out to Larapinta Drive. To the communities that surround Alice Springs, again we say to you, stay clear of Alice Springs for the time being. We will ensure adequate messaging is getting out to you on the ground. Again, there is no need to panic. We will also be in touch to facilitate the movement of food and adequate supplies and clinical service and medical service if you need it. You know your local clinics, you know your local stores. There is no need to panic. If you need assistance, if you need guidance, please ring the COVID hotline. Alice Springs knows that if they come together, as I know they will, an incredibly strong and resilient community, they will see this through very quickly. The wastewater testing will give us a great deal of encouragement once we know that result. We will also get, as I've said, the information we can to you as soon as possible as we can articulate the definitive movements of this individual. That information will come out later this afternoon. So please continue to monitor your reliable media outlets as well as our coronavirus.nt.gov.au website and our Secure NT social media pages. More broadly to Darwin, as has been touched on, particularly with the Buff Club, we're now down to 6 outstanding. As has been mentioned, we've been actively working to ensure that we're contacting all individuals we possibly can. I also put the call out to any of you who have not been contacted yet, who have not been able to make contact with us, who are hearing this for the first time. Please make that contact. We want to ensure that you are well. We want to ensure that you have a test, and we want to be able to prioritise that test for you for the greater certainty for the Northern Territory community and the Greater Darwin lockdown area at this point in time. We have many moving parts continuing to go on. I visited the Marara facility this morning. We've done a lot of work overnight as it relates to traffic management plans. As people head there, and again we encourage everyone to make a booking. You will be guided into various sections of the car parks of the many facilities down there where we will be able to fast track assurance that you've made your booking, that you've got all the adequate information, which will streamline the process and the speed of which we're processing. The efforts of many Northern Territory public sector employees, police, fire and emergency services personnel and other not-for-profits who have been out in the field providing assistance cannot be understated. The Northern Territory is very blessed to have the heroes they have, but the work is nowhere near completed. We will continue to work hard to narrow down every individual that we understand is a close contact. We will ensure that their testing is undertaken so that we can work towards, as quickly as possible, enabling the Northern Territory and its various locations to return to the freedoms that we've enjoyed. Thank you.
Run through, so he didn't test positive for COVID-19 as at the Alice Springs airport, but he didn't test negative?
He didn't test positive. That's absolutely accurate. The reason why he tested negative we're not clear of right now. So is it a false negative? Is it a week first test, etc.? So the grounds for the negative result we're not clear on. We're obviously not the South Australian system. We know of this because the household contacts who tested positive, and he's now being retested. So there's a lack of clarity about why that first test failed. So that's why I was clear to say he did not test positive.
And so those household contacts are all in South Australia?
Yes.
And how confident are you that he's definitely the cause of their...
Very confident based off the information out of the South Australian CHO to our CHO, and it follows a very logical line. And this is one of those instances where I'd rather be proved wrong than not in this instance. We obviously have now a number of people who tested positive out of the Tanami as a result of that Queensland hotel quarantine failure. And this is a household of a Tanami mine worker. So there's a very logical series of steps here that we can follow and act on as a result of that.
Turner's called for rapid on-site testing for FIFO workers entering and exiting mine sites, particularly remote mine sites near remote communities. Do you think that should be standard practice?
I might pass to Dr. Heggie. Every mine site has a very rigorous COVID-19 safe plan. There's a different number of things in it, so I might pass to Dr. Heggie to comment.
Is that something that you would support?
I just want to be clear. Each mine site has a very rigorous plan. There's different requirements in it. I want to be careful about how I approach that question, because it's probably something that Dr. Heggie has already considered, and each mine site might have a different requirement. They've got different requirements placed depending on their COVID-19 safe plan. So I think it's an important question. I just want to make sure we answer it accurately and in detail.
Thank you. An important question. I would say, first of all, mine sites vary from very large and very, very small when it comes to exploratory activities, sometimes only a couple of persons. In this case, a large mine site has often common areas, and this would seem to be one of the ways that people have spread the virus at the site. Particularly if you are working with a particular group. Now, I want to speak to testing. I agree we need to consider, in the light of the new variants of increased infectivity, that testing may be part of a COVID plan for a mine site, the company. That is true. It needs to be considered what test is used, what platform, because some are less sensitive or they can only test a small number at a time, in terms of the number of tests that you can complete, because each test requires a separate cartridge. So as part of this, though, it's also to be considered by companies that have mining activities in remote locations around the country, that vaccination is also, to a degree, another protector, although we have the evidence that you can still catch the virus when you have been fully vaccinated. So I suppose the conversation to be had with the sector, and indeed other sectors too, because it's not just mine sites. There are people that conduct other activities out in remote locations, and there's of course a whole lot of tourism that's going on in the Territory at the moment and in other parts of Australia, particularly in our natural environment. Important thing to bring into the conversation, but it needs really to be considered, as I said, about what and who, and would it be part of a plan. I think most importantly is that we review all plans for all locations and all activities in the Territory. We do this already, but we need to refresh this in the light of what we're seeing with these more infective, not necessarily more virulent variants.
Can I ask what the plan is for people who are sleeping rough in Alice Springs?
Thank you. That's another really important question. I mentioned earlier that we're partnering with the Tanangera Council and our welfare group that has representatives on the Emergency Operations Centre in Alice Springs to assist those people to whether they need shelter, because it is cold overnight at the moment, and also making sure that they've got food, and to make sure that they've also got masks. So this is a strong partnership, and we work closely with the community controlled sector in the Northern Territory and other cultural groups. But again, really important that people, and not just Aboriginal people, receive the supports that they need.
But do people who are sleeping rough at the moment have to lock down? Because we're seeing at the top end that there isn't an accommodation solution for them.
Yes. Again, really important question. Now, for those who probably understand the context, and I can speak for both Central Australia, Alice Springs and for Darwin, people generally do not necessarily sleep in different places overnight. Often it's the same place. And it might be outdoors, that's true. So it's about working with local partners to identify those people where they want to stay. The main thing is that they don't mix with the rest of the community. And that's probably the most important thing. There may be actually opportunities for some of the town camps to assist.
So Danila Dilber is saying that they've had 4 tests done. That's just in the last couple of days, and people who are sleeping rough, they've been released back into the community to use the same shopping centres, parks, streets as everyone else. How is that an acceptable risk?
Well, we're strong partnership with the Larrakia Nation around where those people are. It's important that those people who actually had a test done, I guess I would say what has been their exposure risk in terms of where they've been in the places that we now know are exposure sites. So people are also being tested from the community that are going back to their homes and also going to as we said before, the essential reasons to leave.
What are the wait times for COVID test results at the moment in the NT?
They are very short at the moment because we're prioritising those ones. This is most important. I know there was an absolute surge on testing yesterday, and the Commissioners described how that will be improved. So there's 2 things. One is the testing that is less important because people are in quarantine, and those are the international travellers. That can be sent interstate because they're going to be in quarantine. Second is that we need to prioritise the people from the exposure sites, and there's going to be some mobile activity so that people who are actually higher on the list of exposure sites will be contacted to potentially even arrange a swab to be collected at home. We've also got a partnership with another pathology provider who is assisting as well. So I think the turnaround time, I could be confident by saying it can be now in a matter of hours for the highest priority results.
Can you clarify how many from the Buff Club have actually been tested?
Sorry, question?
Can you please clarify just how many from the Buff Club have actually been tested?
I believe that was described by the Chief Minister before. I don't have those numbers in my head. I recall that I think all of the people have been located, but I'd have to ask perhaps the Commissioner or the Chief Commissioner for that.
The numbers of the Buff Club have changed over the last few days as we've done the contact tracing. So we're now out to 179 people deemed close contacts at the Buff Club, and that's a result of the tracing efforts. And I'll give you an example. Talking to somebody who did check in, but didn't check in their mate who was with them. So that's how we're now out to 179. We are currently at 8 people who we have not identified as directly isolating as a result of being at the Buff Club, and police are on to tracking down those 8 people. They should obviously be staying home at the moment under our current general lockdown orders, but we are closing the loop on those 8. All test results out of the Buff Club so far are negative, and they are either, so negative. I can't give you the exact number out of the 171. There were some still pending, but in the system, but all back negative so far.
But
And I'll get you.
Not all of the 171 have been tested though yet, have they?
All been, my understanding, tested and pending. So I'll get you the exact breakdown of the test results. So my understanding is that there are a number who have tested gone through the system come back as a negative, and there's also an amount that are appearing in the system we don't have the result for yet, and there are 8 who are tracking down to isolate.
Just because I know of at least one person who had got caught up in the testing at Marara and is a contact at the Buff Club and got turned away and can't get a test until later this evening. So sort of along those lines, what do you...
Okay, so that's in that category where we've got them in our booking system, so we know we've tracked them, we know they're booked. And so we've got confidence, obviously, in the testing regime around that person. So I know there are a couple people who I spoke with, elderly, who... I'll go back a step. We're now directly contacting everybody who was at the Buff Club to reinforce with them. If they stay home where they are, we'll go get a test sample from them. So there are a couple of people who went out to the Marara to get booked from the Buff Club. We're saying now to all of those individuals, stay where you are. We'll have a testing kit come to you and take that if you're in that little group.
Given what we saw at the surge at Marara yesterday, is there a need for extra testing, mass testing sites like that?
It's partly why I went through the Alice Springs exposure site description so carefully. It's about making sure that we get the testing done in the right order. We saw a lot of Territorians turn out yesterday, which is excellent. And we obviously had at Marara both booking stations and non-booking stations, and that saw a very significant queue. We're obviously now providing greater clarity about who we want to go get tested when, and that we went through that with the Alice Springs stations. Obviously, we've got no new exposure sites here in Darwin. We've got 1,800 people booked in for their tests today. We're going to go directly to people's homes if necessary for testing as well, if they're in those high priority areas. So we're working through that now. We actually had ability to do more testing at Royal Darwin and Palmerston Superclinic yesterday, which are book-only sites, but lots of people went to the Marara site. So we actually had some capacity elsewhere. So today, we believe through that booking system with no additional exposure sites, we can handle it here in Darwin. But there was a desire from a lot of people, which I understand, to go directly to the Marara site that we stood up. But we're confident today that we can work through who needs tested, where we get them done, where the bookings are, and how we flag that in the system. So those are the priority bookings.
So is the top end still expected to come out of lockdown Friday? What's your thinking toward that at this stage?
Early indications this morning were positive. I think the way I'd phrase it, though, is that we still want to see some results back. But having no new tests, having no new exposure sites puts us on a very good footing for the 1 p.m. on the Friday. Obviously, that took a U-turn after the phone call from the South Australian CHO around the Alice Springs situation. That's probably my main focus of attention right now. But here in the top end, we want to work through, obviously, those outstanding tests from people who went to exposure sites. The wastewater that the CHO mentioned is informative but not determinative. But tomorrow's wastewater result will be even more informative, if that makes sense, with the cycle that we're in. But so far here in the top end, the results are on track where we would like to be for a 1 p.m. lifting. But, you know, everyone still treat this seriously, still obey all the instructions, still do the testing. We've still got a lot to work through. So we're just at a good tipping point here in the top end.
Do you accept concerns from Aboriginal health services that the lack of accommodation for people sleeping rough poses an unacceptable risk, not just to Aboriginal people, but to the wider community?
It's really important that we look after everybody. Rough sleepers are some of our most vulnerable, and we are very mindful of them. We want people to stay safe, stay separated, and in many ways stay static. The worst thing we could do will be how we might handle a cyclone situation where you stand up a showgrounds and you move everyone to one location. That would actually be the most dangerous thing that we could do. The clinical advice is very clear about what's the best thing we can do to keep people safe, and that is to keep them safe, keep them separated and keep them static where they are, and it's about providing them everything they need for where they are currently staying often. There are accommodation options available. Baton Road, for example, is stood up and is taking people, and we've been working through some of those situations. So it's not that there are none, it's a case of working through carefully where the best spot is for people so that they are safe with their welfare front of mind. But the clinical advice is very clear. There has been some desire to group everyone. That would be based on the clinical advice I've got from Dr. Heggie, the worst thing we could do for people. I understand that there are people who are getting tested who aren't necessarily under an isolation order, so isolation isn't what's required. Not everyone who gets tested under an isolation order, that's correct, isn't it, Dr. Heggie? So it's got to be very mindful of how we handle all this. We're having lots of meetings, lots of conversations with all the different service providers, taking on all the advice that we can get, and then trying to work through what is the absolute best thing that we can do for everybody. No one's safety or health or welfare comes second. If you're a rough sleeper, we're trying to do everything we can that's best for you, and that is often about not moving you into a situation that actually would expose you to the virus. So that's what we're really trying to avoid.
So can I just clarify, you've just said it's not that there's no accommodation. Are you saying that there is enough accommodation for all rough sleepers across the top end and Alice Springs?
No, that's not what I said.
Okay, so how many rough sleepers are there that there isn't a solution for?
So we have a permanent abiding situation in the Northern Territory in all our communities where there are a significant amount of rough sleepers, and these are people who often choose to sleep rough. We have accommodation options available. So, for example, at Baton Road, we have a number of beds. And so when I say there are none, there is a capacity to work through providing of housing for people at Baton Road. But we've never had in the Northern Territory enough for our significantly mobile population who are homeless. And unfortunately, part of our problem is the significant mobility of our homeless population. Unlike other jurisdictions where usually people who are homeless are static in that location for 12 months, we have people who go in and out, and the majority of our homeless population, one reason why it's called itinerant, 60% of them are usually moving, constantly moving. So no, we don't have in the Northern Territory enough accommodation for all our homeless. I cannot solve that right now in the middle of a pandemic. The clinical advice is unlike a cyclone situation where we would move people who are sleeping rough and at danger from cyclonic winds into the showgrounds. That will be the worst thing that we could do right now. We can't handle this emergency like we would handle a cyclone, move everyone into one location that's safe from cyclonic winds and sheltered. That will be the worst thing we could do, and it will expose them to the virus. There are some accommodation available in Darwin, as they always have been. Those accommodation options aren't always taken up by people who sleep rough. Unfortunately, there are people who they choose to sleep rough, and I am not going to forcibly move them. I think that would be inappropriate. They've made an informed choice. We are working with all those groups now to make sure they are as safe as possible, have all the food or other masks and other things they might need at the location they currently are. But the clinical advice in a pandemic with a virus that spreads so quickly is one of the best things we can do to keep them safe is to keep them static and separated from others.
Do you have any idea on the numbers though? Because clearly you've created some, or an increase in that group given some people haven't been able to go home under the restrictions.
So because of the nature of how they live where they live, I've always estimated it at around 1,000, but that is a number that can go up or down. It's a volatile number, and it's not one you can always have hard data on, unfortunately. The Commissioner might be able to add to the numbers that we're currently planning to.
Thank you, Chief. We certainly work at any given point in time between 1,000 to 1,500 plus people that would identify as sleeping rough. What the community can be very reassured about is that there is much engagement occurring, not just from my own police officers, who you would have seen images of them handing out masks, engaging with people, but we're predominantly talking about adults here who are making a choice as to where they choose to sleep. As part of our response to that, we stand up what's referred to as our welfare group. That's part of our functional groups under our emergency management structure, and they've now been working with many of the NGOs and not-for-profits as to how we best service that group of people. There are now meals that are being provided in respects of that. We're ensuring that people have appropriate hygiene access, medical services if required and the like. So there is a high level of engagement that's occurring out there, but at the end of the day, there are people who choose to sleep outside, and we're trying to make sure that they have great awareness that the direction is very specific as it relates to the mask wearing. So if they're outside, they must wear a mask. If they maintain the 1.5 metres, again, similarly, if they need to go to the supermarket, they observe all of the obligations that are in place for every single individual there as part of the exemption that's available to them. As it relates to those who go for tests, again, I would have a high deal of expectation that the relevant clinic or medical practitioners would understand what risk that person poses, directly linked to the show directions that are in place. They all have access and copies to those show directions, so they know who would be subject to an isolation order, and if they feel that that person has no true place to go and isolate, they simply get in touch with us through the welfare group and we will facilitate that. There's currently 110 rooms available at Batten Road. There's work underway to try and look at increasing the size of that, and we continue to see people who've been taken in by family and friends, and for the large proportion we're not seeing any flow of antisocial behaviour as a result of that. So I have to commend the engagement that's been undertaken and certainly the behaviour that we've witnessed to date around the rough sleepers. They understand the seriousness of this and they're certainly actively engaged with our people and have many means, even in the event that they don't have a phone, to be able to get in touch with our people due to the frequency of our interaction with them, either from a police perspective or our other essential services out there.
Commissioner, I don't know if this is for you or the Chief Minister, but we've seen reports over the past few days of the miners currently in isolation at the mine being under extremely poor conditions, given that where their accommodation is, it's not meant for long-term stays inside. Food has been certainly very inadequate. What do you say about that? And should those miners have been able to be chartered to Howard Springs or the Todd facility?
Our practice has been that we will move those who are most at risk and likely to potentially transition into being positive from the cases, and that's what facilitated the transfer of the charter flights relatively early in our response to this. I've spoken directly to the rapid response team that's on the ground. I'm also aware of the communique that the management of Newmont have put out to their employees there. They've purchased kettles, they've purchased additional televisions, we've upgraded the 4G network out there. We coordinated the flying in of a further team that can provide all the meals. The teams are focusing on providing welfare and care packs. They've now facilitated access to 2 beers per person per day, just to assist with some of the mental health. There's access to their verandas. They're working through some time for them to go and do some exercise. Certainly the brief I had from the ground yesterday was that a lot of those early issues were raised, identified, treated, and the people are understanding of the fact that the safest place for them, as well as the safest place for the community at the moment, is to complete their 14 days in that locality.
Commissioner Chalker, yesterday you said that police had asked the Defence Force for assistance to maintain border checkpoints, but Defence says they haven't had any requests for extra support. Has that request been made?
Who'd you speak to in Defence, Letitia?
Oh, I'm sorry, that's a question that's been passed on from our Chief
So
of Staff.
the formal request went through last night. It's a formal request process that's been received, and as I say, I've got strong indication that support is forthcoming.
Commissioner, sorry, I lost my chain of thought. Construction workers. In the first lockdown in March 2020, they were allowed to continue working. They were deemed essential, but in this lockdown, they aren't. Could you just give some words to why that has been decided?
Well, I think the fact that the Delta variant is what we're now dealing with and the high transmissibility rate of that has moved the goalpost for the CHO. I am certainly very confident that the CHO is making his decisions based on the best clinical advice that he's receiving constantly from the AHPPC and all the other experts that are providing information in this space. So again, let's just go back to the overarching premise here of what this lockdown's about. If you do not need to move, if it is not essential, don't. That's how you're going to get back onto that work site far quicker.
Thank you.
Thank you.